Good evening and welcome to this evening's webinar. I'm Ian Craig, your host. These webinars are usually hosted by my colleague Simone DeCarmo, and she's enjoying a well-deserved holiday this week, so I've stepped in for her. Excuse my Barry White voice. I'm just been ill the last weekend, so just picking up and feeling better now. So tonight, I'm really interested and excited to listen to Whitney. Whitney Iles is one of our diploma students, but I always use the word students very, very carefully because most of our students are actually practitioners in their own rights. Whitney is doing this presentation on her base of knowledge on trauma-informed sports and nutrition, supporting athlete resilience. And she's basically pulling from one area of interest into another as she's developing the sports and nutrition aspects of her practice. Whitney, next slide, please. So all of these webinars, this is now the third one, the webinar series that started now in 2025. They're all produced or presented by our diploma course students, stroke practitioners. So just give you a little bit of information about that diploma. It's a postgraduate or a level 7 postgraduate diploma equivalent in standard to a master's degree. It's 120 credit hours. And it consists of two long base modules, which are integrative body systems, so that integrative thinking within a sport and exercise context. And then the next one is applied performance nutrition. And then everyone gets an opportunity to do 4 specialty modules. So for example, Whitney's on the mitochondria module at the moment. We have ergogenics, we have gastrointestinal, cookery, what else? We've just done a mind-body, REDS, and we've got a few others, and we're always adding to those. So the diploma course is open to individuals ideally with a university degree or a level 6 qualification in a related subject, but we also realize that some very highly qualified individuals come from different areas or different backgrounds. So we also ask for a diploma, sorry, a portfolio to be put together by people coming from different areas. And our next uptake of both the diploma course and the certificate course starts in 2 weeks on the 27th of May. So just shout if you've got any questions about that. For now, over to Whitney. Whitney's going to present for 45 minutes or so. She's going to have certain areas that she'll want some participation. So just listen to her questions, and if you've got some input, please put it in the chat box. And we'll leave a little bit of time at the end for Q&A. Okay, so enjoy.
Right, good evening, everyone. My name is Whitney, like Ian said. I am coming into sports nutrition from a background of youth and community work and with a specialization in kind of working with people who've experienced trauma. And 3 years ago, I would have never seen myself doing anything around sports nutrition, but I was led here due to my kind of interest and fascination of trauma. And I started off kind of training as a psychodynamic psychotherapist. So everything was about the mind. And the more I started to learn about trauma, the more I was realizing it's way more than kind of the mind by itself and the mind's experience of the world. It was also about kind of what was going on neurologically and then what was going on biologically and kind of this whole somatic experience of trauma. And my kind of journey into nutrition and sports nutrition was because of my fascination on the kind of the body aspect of trauma. So hopefully today I will be able to kind of share some of my interests with you, and you will kind of enjoy that and find it as interesting as I do. Now, I know we are speaking in the realms of sports nutrition. I do trauma training, kind of my day-to-day work. And I think in any kind of realm that we talk about trauma, it's really important to be mindful that even though we're here to learn, it can have an impact on ourselves as well. So I just want to kind of give that permission of just to be mindful of self as we're kind of experiencing this learning together today. And be mindful of how you're feeling kind of throughout the session. And if you want to kind of experience this by kind of going on a walk and being on your phone and getting up and kind of walking around, moving your body, or needing to take a break, these things are all kind of completely fine. Kind of even when we're just learning about trauma, it can feel quite uncomfortable within ourselves as practitioners just to think about these kind of big and overwhelming things. So I always kind of have this marker of, let's just be aware of ourselves as we're doing this work. Now, I will say, sports nutrition and the world of nutrition, it still feels very new to me. And, I still get a lot of kind of anxiety of my own kind of presenting into this. So I will be kind of, I think for me, when I've come into this world, what I've learned is there's a lot of kind of presentation around trauma and chronic stress, or chronic stress more so. And they tend to be kind of very similar in those presentations of kind of looking into the biomechanics, the nervous system and the kind of what supplements that we can use to support someone that's experiencing trauma or has experienced trauma. I want to kind of add a different perspective to that conversation today. And I want to see if we can kind of develop our minds and our capacity to think about trauma in a little bit more depth and think about the kind of the different levels and the aspects that kind of trauma can add to the equation when we're working with people. Now, I love interaction, and I know it is a Wednesday evening, and we're probably all very tired, worked all day. I am just thankful because it's hot outside, and there's many other places that you could probably be. So I'm very thankful that you're here today. And I know that you're probably kind of doing a million things behind your camera. But what I will ask is, if you do have questions, just ask, because what I really like to do is incorporate that kind of experiential learning, that kind of what's happening in the space, what kind of the things that we're dealing with as we're kind of going through this. And that interaction can make it a little bit more interesting because I can talk and I will probably go off on a few side quests throughout this presentation, but I would really like to kind of know what you're thinking and what kind of questions that you have. So feel free to kind of ask them as we're going along. I've got the chat open. You'll see me looking at this other page. I can see you all here. I've got two screens. So interaction is welcome. Okay. So first of all, I wanted to kind of start in this kind of definition of trauma because trauma is something that it's a word that I hear a lot. It kind of just in all the roles that I do. And it tends to be this kind of thing that we think about that can be quite kind of big and overwhelming and out there. So I wanted to just to take a moment to think about kind of what is this, what is the definition of trauma? What are we thinking about? So we can think about trauma as this kind of psychological wound and it refers to a kind of subjective experience of a person or people following exposure to a frightening event. And it describes this enduring sense of distress and unsafeness that overwhelms individual coping mechanisms. So it's really important to understand this kind of individualization of trauma. It is very kind of subjective to that person. And it's really important to understand that trauma isn't just the action of something that happens. It's how that action is perceived or how the experience is perceived. So it could be a very life-threatening event. It could be something very serious and that it was definitely going to do harm. Or it could be something that is perceived to do harm. And sometimes we might be listening to someone's story or thinking about something and being like, well, why did they have such a big reaction to that? But it was about that individual's kind of reaction and perception of that event. So here we're already kind of starting to understand that it's about this individual's relationship to their experience, right? And there's going to be loads of factors that kind of go into that. But really, when we're thinking about trauma, we're thinking about something that overwhelms the coping mechanisms of that person. And I want you to just pay attention to that because we're going to go into that in a little bit more depth in a moment. So we can be thinking about trauma as an experience, as a one-time experience. And a lot of the times we do think about trauma as maybe a car incident or maybe kind of being mugged or being assaulted and these kind of one-off really bad experiences. But it can be kind of multiple long lasting events. And we'll go into that in a little bit more depth. But again, it's really important to understand that each person responds differently to trauma and due to kind of a multitude of reasons behind that, right? So at the first stages, we're thinking about trauma as this event or this kind of series of events that overwhelms a person's coping mechanisms, right? And why does this matter? Why am I so interested in trauma, right? So it matters because trauma, especially when we're thinking about childhood trauma, which is an area where I really specialize in, it can create these kind of neurological and biological changes. We have something called the adverse childhood experience kind of research, and it's known to kind of create these changes which can impact physical and mental health. But one of the things that is less spoken about, especially kind of as I've introduced myself into the world of nutrition and sports nutrition, is the relational changes that trauma can have. And what we're thinking about relational changes is we're thinking about the relationship or that the person has with themselves, with others around them, and just the world in general. How has this trauma impacted the way that I see myself? And how has that then impacted the way that I see others and the world around me? And here we're going to start to think about how does that kind of work on the relationship that I have with health, that I have with well-being, how that I have with food and fitness and all of these kind of aspects. So when we're thinking about childhood experiences, yes, so Scott has written into the chat that it's always good with athletes to kind of be aware of any kind of big anniversary dates and these triggers, right? Because this thing with trauma is very interesting in how it kind of sits in the body and in our memory. So again, the brain doesn't really know the difference between what happened in the past and what is happening now when it comes to trauma. We can think about it as I feel like hopefully everyone on this call still remembers kind of when we had photos and everything wasn't just digital and we would print out our photos. I remember like when we would print out our photos, when we would first get them, they would be in all these beautiful colors. But then over time, especially if you left them out in the sunshine, these photos would start to dull down. Like if you look at like some of the older photos that you have, they might have this kind of this brown tint to it or this gray tint to it, and they fade over time. And that's essentially what many of our memories do. But some of our memories have a bigger kind of emotional connection or emotional memory attached to them or emotional feeling attached to them. That might be kind of big birthdays or the first time we had our first love or our first heartbreak or our first time that we went to secondary school or our first kind of dance recital, all of these kind of things. They have these big emotions attached to them. So when we experience those memories, we get a flashback of some of those feelings. Now, the thing with trauma, that when we remember trauma in that same kind of full color picture. And that's not necessarily a conscious memory. That's a very unconscious memory. But we'll still see and experience that trauma in that same kind of intensity as when we have experienced it the first time. The brain doesn't know the difference, right? Trauma sits in our body, and what it does is it informs our future. So it's very hard to be in the present when we're experiencing trauma, because trauma is all about the learning that we've had from our previous experiences and how it impacts how we see the future in order to remain safe and to not have to kind of experience that kind of those same things. So it's very much these are the things that I've been through, and how does that shape how I'm kind of predicting the future in order to keep myself safe. And when we're thinking about some of these kind of experiences with the adverse childhood experience kind of research, what they were focusing on was the kind of the physical abuse, the emotional abuse, the sexual abuse, neglect, which is physical and emotional, things like household dysfunction. So domestic violence, substance misuse, parental separation, parent in prison. And then later on, it started to expand and it started to think about bullying. It started to think about war. It started to think about community-based violence. But we could also even expand that a little bit further and start to think about kind of economic adversity and poverty and what that experience is like, not knowing where your next kind of food is coming from and constantly being in this state of survival, just trying to kind of live in life. And what does that mean when there is trauma involved as well? And we can also think about things like systemic harm, like racism. And what does that mean when you're moving through the world as a racialized person? And that racialized person is going to change where you are within the world, but we're thinking about people who are othered. And so when we have these kind of these incidents and these things that are happening, they may have happened in childhood or throughout our lives, but our body and our brain doesn't necessarily see it in the past, which is why it's important that we think about kind of what are some of these kind of big dates or anniversaries that might be coming up, because what might happen is it doesn't necessarily express itself through a conscious thought process, but it can express itself through our body. And this is where kind of fitness, and we can start to kind of see the intertwine here when we're thinking about, we might be thinking about kind of the athletes that are competing and understanding kind of where in the year that they might experience kind of differences with their sleep because of these triggers that are coming up, how that might impact their ability to rest and recover, how that might add to inflammation and all these kind of things. But we can also be thinking about it in relation to how we're supporting the day-to-day gym goers, or the kind of those that are more intermediate in the work that we're doing, and how, you know, is that going to be a case where when they've got big things coming up, are they going to go harder in the gym? Are they going to pull back from the work that we're doing? Do they then experience more pain in this kind of in these time frames? So yeah, Scott, I think that's an amazing thing to bring up, to think about kind of where we're thinking about triggers and where we're thinking about kind of anniversaries. And I think it's also kind of important. So again, just to emphasize, trauma is such a big subject within itself, right? And traumatic experiences, there's a whole range, and they mean, it's all about the individual and how the individual is experiencing something. But we can think about trauma as like developmental trauma, for example, right? So it doesn't necessarily have to be something kind of in adulthood. We could be thinking about what's happened in the developmental milestones. So when we think about developmental trauma, we're thinking about children. We're thinking about, under 18, or even in a lot of cases under 25, because developmental kind of trauma is in those developmental phases of that kind of 0 to 25. In fact, you could even add kind of fetus, you could even go back into kind of the state of parents when, they're getting pregnant, right? We're thinking about relational and attachment trauma, again, which tends to happen in those developmental stages when there's been kind of trauma between the parent and the child, or the caregiver and the child. And what we can be thinking about is not just the physical stuff that happens, so what has physically happened to a child. So we can think about it in the sense of things that have happened that shouldn't have happened as trauma. And we can also think about the things that should have happened that haven't happened. So, for example, if you have a mother that has postnatal depression, and she does not have the capacity to think about a child, then where does that child get thought about, right? That containment, that emotional regulation tends to happen between the child and the primary caregiver. So if they're in a household where mother is the primary caregiver and she is dealing with depression or anxiety, she's not going to be as in tune with that child's needs as someone that is able to hold that child in mind. And this can become kind of really big later on in life. And we'll delve into that. But there's a lot of research that says if a child has a really kind of solid connection with someone safe, someone that's regulated in that first 6 months, and then they go on to experience trauma, there is still they see a lot better results in relation to healing from that trauma, rather than a child that hasn't had that person, or that abuse has occurred in that first 6 months, and then they go on to have a kind of normal, what we would consider a normal functioning regulated life. So that 6 months, that first 6 months is very key. And again, that's because of that, the how quickly and how fast the nervous system is developing and the brain is developing, and how these neurological connections are being made. So we're thinking about trauma, we're thinking about it as the single event, we're thinking about it as multiple events, we're thinking about it as transgenerational, as historical, as racial, as systemic, right? All of these things. And this is where trauma work can get quite overwhelming, because we're like, wow, this is so much to think about, right? And then we can be thinking about kind of what are the kind of the intersections around that, the neurodivergence, and you'll see with the neurodivergence, developmental trauma is still put under that, because it can get then put into that neurodivergent kind of category. And we think about the other identifying factors. We think about age, we think about gender, we think about nationality, language, like language barriers and all of these things, right? So kind of getting into some of the biology around this, and with the ACEs study, you know, the ACEs was thinking about more in relation to like geographical areas rather than individuals. But a lot of the time, the ACEs work has been misinterpreted. So, for examples, in schools, I've known of schools that will do ACE assessments, and they'll go, right, you've had four ACEs, so four different types of trauma, therefore you get therapy. You've only had one, therefore you get mentoring. So it's not necessarily thought about that. So it's not just because you've had trauma, these kind of biological things are going to happen. But what we do know is for people that have experienced trauma, especially unresolved trauma, we can see things like an early death. We see kind of higher disease. We see more likely to develop depression, kind of more likely to kind of experience addiction, more likely to be smoking and experience lung disease. We could be thinking about kind of the health choices that they make. We could be thinking about obesity. We can be thinking about autoimmune conditions. There's a lot of things that kind of in relation to trauma that has this biological impact, which I'm sure most of you will kind of be aware of. But there's this whole thing around kind of, well, what's the difference between having a traumatic experience and becoming traumatized, right? So if I ask that to the chat, just to see who's there and interacting and paying attention, what would you think is the difference between kind of this? We can think about it as a acute stress, but we can think about it as someone who's experienced something traumatic and having the normal experience that you'd expect someone to have, or the normal response you'd expect someone to have from a traumatic experience. What do you feel like might be the difference between kind of having a traumatic experience and becoming traumatized by that experience? Does anyone want to give that a go? I saw some looks on camera. Give it a go. What you got to lose? What could be the difference between this kind of traumatic experience versus becoming traumatized? Yeah, so Scott is saying always interested around ACE identification. Is that if that's my normal environment, how do I know any different? How would I know that I was subjected to ACEs? And you're right, there's a lot of people that kind of grow up in abusive situations and don't know that, and that becomes their normal, right? And this is what I mean about kind of developmental trauma being very, very important to understand. Because if a child is growing up, say, for example, in a domestic abusive relationship, their kind of neurological programming is going to be love and fear. So my love response is my fear response. These become intertwined, right? And that starts to kind of be embodied as well. So yes, that one's perception of events, your individual response and sensitivity to that experience. Some might act defensive if exposed to that stimuli again, or could shut down emotionally, right? So yes, this is all right, but this would all feed into that kind of very normal traumatic response. We would expect that kind of difference in mood. We would expect that dysregulation. We'd expect that kind of that sensitivity to kind of have an impact on how we experience that kind of traumatic experience, right? But what we're really looking at as practitioners is how long is that response, right? So we would expect if someone has experienced something traumatic for there to be this kind of this response to it, right? But what we'd be looking at is how long that response, how long does that dysregulation last, right? So you might work with someone who experiences something as you're working with them. And then you would kind of work with that trauma in relation to looking at kind of regulation. Okay, you've experienced this bad thing. How can I work with you within the gym environment, within kind of running or whatever the training that you're doing to support your body going back into the state of your normal, right? Not the normal, your normal, because I already kind of knew you prior to this relation, prior to this experience. This experience has happened, you've had a response to it. We're going to work within this response to regulate your body, your nervous system. When we're thinking about kind of people who become traumatized, we're thinking about those people who are not regulating after that experience. And you guys are right. We're thinking about someone might have a hypersensitive nervous system, but they also might not have anyone to talk to after the event. They also might be younger. So if traumas happen pre-verbal, that's not going to be able to be spoken about in a lot of cases. It becomes very much in the body. We think about kind of the access to the resources and all these factors. Are they believed? But also kind of really kind of well, what was said, that perception, that relationship to that experience. So if something happens to you and you believe it was your fault and you are the reason that this thing happened and that you deserved this thing, you're more likely to become traumatized by it. Whereas if you have an experience and you've got someone to talk to, someone to cry with, someone to regulate with, someone that understands, someone you get access to the right resources and the right people and the right foods and all of this kind of stuff, then you're less likely to become traumatized by this event. And again, so we're talking about the nervous system here a lot of the times as well, right? We're talking about the fight and the flight and the dysregulation and the it kind of your sympathetic and your parasympathetic and this brain to gut kind of relationship, right? But this is all coming from, again, like we were saying, our perception of the world as well. Is this world a safe place? Do I feel safe in my own body? What are the triggers that are around me that might make me feel unsafe and then put me into this state of kind of fight or flight or freeze? And what is the impact that this is going to have on all of these other systems, right? And again, huge subject. We could go into this in such detail. It's kind of why I love it. But essentially, this is what we're thinking about. Now, any questions so far? Anything you want to whack into the chat before I keep going? Because I've been telling you I can talk. Not seeing anything. I see people smiling. All right. At least you're still there with me. So I wanted to introduce you to kind of some of the more kind of popular psychologists in this realm. A lot of people like to read books or learn more about things, but there were some things that I found interesting. I'm sorry that they are all men as well. I was on a tight deadline, but Dr. Peter Levine. Now, what I really find fascinating about his understanding of trauma and how he works with it is he believes that trauma, or his understanding is trauma is energy stored in the body. Now, this is where I really start to see this overlap between trauma and fitness and how trauma and health and well-being and movement really start to intertwine. So I think about, even if we think about emotion, and there's other books that are written and they think about kind of emotion as energy in motion, right? This energy that moves through our body. And what Peter Levine is saying is that it's when we experience trauma, we have this frozen energy. And it's this frozen energy that sits in our body that we experience through our nervous system, that we experience through our musculoskeletal system and all the kind of the intertwines within that. And he thinks about kind of things like back pain and migraine and chronic fatigue through the lens of trauma and through the lens of, how this frozen energy is in the system. And you can even think about kind of when we're in this sympathetic state, what our bodies tend to do is keep us in this place to move, which tends to keep our heads forwards and our rib cage is low. And it's almost like you can feel like you're getting ready to run, right? I know a lot of you here work with runners, right? And when you're working with runners, you know how their bodies move. But it's if we think about kind of what does that mean to be in this state of protection or this state of wanting to flee all the time, and how that can hold the body in a particular way to then kind of cause this tension and this stress and these kind of points of kind of frozenness, or this points of tension, and how that can be kind of the trauma, right? We can also think about it. I think about back pain as, if you're in a scary environment, what are you going to do? We tend to, do this. If we've jumped at a firework, we can do this. And you know, that kind of holding that tension, I see a lot. And I see it a lot in the practitioners that I work with that are working with the trauma. And this kind of shows how this kind of vicarious trauma can work as well. Yeah, so Scott is saying he can see how the last couple of slides can relate to that phantom limb syndrome. That would be a whole nother rabbit hole, which I would be very excited to go down. Another one of the kind of more popular guys is Dr. Gabor Mate, and he has a very interesting book called When the Body Says No. And again, so he believes that some, not all, right, we're speaking in generalized terms, that emotional trauma, when it goes unresolved, can become very embodied in the body. And it can disrupt the immune system, the endocrine system, the nervous system. I'm really sorry if you can hear my big old cat trying to get into my office right now. I'm pretty sure he's making a hole in my door. But again, so Gabor Mate is really interesting because he's thinking about how the lack of stress or the lack of expression of trauma and the feelings that go with that, so like rage, for example, anger, how these things can be suppressed and how they feed into physical symptoms. And he speaks a lot around kind of um especially with women and autoimmune conditions, and how there's more and more research looking into how that's kind of like the suppression of like rage and resentment, right? And all of these things and how they interlink. So when I think about that, I think about how could we get women expressing their rage and their anger in their fitness, right? How can we get them moving through that? Bessel van der Kolk again has a body called uh The Body Keeps the Score. Very popular book. It's a book of its day, but it's always worth a read as well. And again, it looks at the hyperarousal, again, the chronic pain as a consequence of unresolved trauma, right? We can always think of something like pain as kind of what could it be communicating with us? If we think about pain, yes, as the physical, but also kind of what could be that communication? Is it a language? So again, we're thinking about all of these things in relation to kind of trauma. We're thinking about this hard uh, muscles and neck tension when we're thinking about fitness and moving, and how do we get people moving? And, if we are working with an athlete and they keep getting neck pain or shoulder pain or pain in their traps or their knees, could this also represent something emotional? Could this represent energy stored there, energy trapped there when we think about kind of tension and protecting ourselves and not feeling safe? And we think about difficulty sleeping and nightmares. And, a lot of these things will be very familiar to you, right? I'm just trying to keep monitoring time because, can talk. So we think about key points. We think about trauma as energy trapped in the body. We think about nervous system dysregulation, and we think about this mind-body connection, right? So this mind-body connection, I think, is really important in what we're doing. And it's easy to kind of get caught up in the biomechanics of it all and the biochemistry and thinking about the HPA axis and the kind of what are the supplements we need to give, and kind of what does this all mean? But I think one of the things for me that kind of gets missed out in a lot of this is kind of this, how does trauma shape our relationships, right? How does the client relate to themselves? How do they relate to others and the world around them? And what I'm really particularly interested in now, coming into the sports nutrition space, is how does the client relate to self in relation to food and fitness? because the client is bringing themselves to us, or actually they're bringing their body to us. And we know that trauma can be very stored in that body. So what does it mean when they're bringing their body to us? And how do we support their, because we're not working directly with their body, we're working with their mind, and their mind, they're working with their own body, right? And how does trauma impact this relationship? And how is trauma then mirrored in their body in relation to kind of this relationship with self? So what do I mean when I think about kind of how does this impact the relationship to self? I think about kind of what is that internal voice someone has developed through their trauma in relation to I'm not good enough, or I don't deserve rest. I don't deserve, I deserve these bad things that happen to me. I'm ugly, I'm dangerous. Like what is the self-talk that is going there? And again, on a very unconscious level. And how does that relate to others? Others are scary, others are unsafe. If they feel like professionals are unsafe, how might that interact with their relationship with you, and how can you create a safer working environment for that would kind of relax and reduce their stress, right? So to give you an example of this, I was working with a client who again had their own trauma, who was in therapy, who was working with mental health teams because they were on SSRIs and wanted to reduce and was coming off SSRIs. And they were able to articulate to me that um, one of the things that really triggers their anxiety is when they don't trust their gut. So whenever like they go out with friends when they really wanted to stay at home, or they said yes to something at work when they really wanted to say no, that would cause a lot of anxiety for them. And a lot of their kind of issues that they were coming to me for was issues with their gut, and not being in tune with their gut, and not understanding that certain foods were flaring them up, and not being able to just make those connections. And when we think about this kind of this role of relationships, we're thinking a lot about kind of shame, guilt, and anxiety. And again, so when we think about food and relationship with food, where could we feel like the shame is coming in there? And we think about kind of, I don't want to go too much into disordered eating, but we can think about some things through a trauma lens in relation to kind of, I do really well, I eat really well, and then all of a sudden I binge eat on a cake, or I kind of go out a lot and I drink a lot more. And we could also be thinking about that is actually this is a person that perhaps is not used to being able to nurture themselves, and is not used to feeling good, and is not used to feeling healthy, and is almost kind of addicted to that feeling of shame. And this is not a conscious addiction, but it gets too scary to be healthy. It gets to, oh, I don't deserve this, right? I deserve punishment. I'm not good enough to be healthy. Let me go and have this food in order to kind of feel the feelings that I'm more comfortable with. And the feelings that I'm more comfortable with may be shame, may be guilt. And I think these are the things that we need to be aware of when we're doing this work in relation to kind of what is that relationship with food coming from? And are we working with clients where we're seeing them doing really well and all of a sudden they fall off? And we're really trying to understand why this might be happening. So I wanted to throw a bit of a case study in here for those of you that are still with me. I know we're like, quarter 22 on a Wednesday evening. So Sally is 32 years old. She has a high stress career, which tends to lead to work in evenings and weekends. Sally loves high rocks. Yes, sorry, she's a high roxer. And she will often attend classes in the morning around about 6 a.m., even though that she can feel quite fatigued due to working late and having restless sleep. However, she has always described herself as on the go, even when she was a teenager, and she gets really bored the moment she's not moving. Sally frequently gets headaches and experiences neck and back pain, especially when she sits down for too long. She is fueled by coffee and energy drinks, skips breakfast, but will have a healthy lunch whilst at work as it's easy to access. And she will cook a healthy dinner when she's at home, but is quite guilty of eating out or whatever is available when she is working. She can, however, manage to eat well for a couple of weeks at a time, but this normally ends with burnout from work and opting for easy options because she finds it hard to think about food. And she has come to you as a sports nutritionist because she would now like to start competing as a high rocks athlete. What are the flags? If you start to think about things through a trauma lens, can you see how some of the kind of where are the flags here where we could start thinking about this could be something else? I'm seeing some typing. I'm just giving you a moment. So I think there's something here about kind of my first flag would be around this kind of constant energy, constantly doing something, right? And this is one of the kind of the risks that we do. And I don't say this about all athletes, but I think about this as a very kind of particular niche um of this kind of this process of always on the move, always having to be doing something. So we can think about this in the sense of through the overtraining lens, so the overtraining and not enough rest, right? And kind of I see this a lot in the hierarchs and the CrossFit world. This constant training, especially when you're not a kind of elite athlete where you get paid to do this, but you're managing a full-time job and you're training around this. And that kind of where does the recovery come in? But when we think about kind of rest and recovery, when we're thinking about it through a trauma lens, we could be thinking about actually, this is potentially someone that was didn't get their needs met as a child and has now kind of not learned how to meet their own needs. So keeps going because the thought of stopping and having to focus in on self is something that's never happened. They've never had that kind of that learning because they've never had someone else to hold them in mind, right? So as a nutritionist, a sports nutritionist, or someone on their team, it becomes really important that we're really able to kind of hold Sally in mind and think about the needs that she might not quite understand herself. We can also think about Sally through the lens of actually, if she does stop, all the feelings that she's been avoiding can then become quite overwhelming. So, actually, this stopping for her, what would it really feel like? So, we could be telling her, right, have a proper sleep routine. We're thinking about sleep hygiene. We want you to eat dinner at this time. When you're eating your dinner, we want you to kind of no TV on, no working, be mindful. But we could also be thinking about, okay, so what happens in this moment when she does stop? And what could that be bringing up for her? So when we're thinking about this kind of this building on this relationship with food and this relationship with self, we could be thinking about, okay, the same way through this lens of training, you don't go in and try to deadlift 120 kg, right? You start with something light. Actually, you start with some mobility work and warming up, and you get up to that and you build it up over a number of weeks. When we're thinking about being able to sit down and eat food and kind of chew your food and go on the and stop being on the go, we might be thinking about it in that same kind of program mentality of this is where we start and this is how we move forward through that. Yeah, and thinking about what is important to her. But also, Scott, she might not know what's important to her because when we're thinking about things like childhood trauma and neglect, actually we're thinking about children that haven't developed the understanding of what is kind of who is she in this world, what are her wants, what are her needs, and what are her boundaries. And I tend to see this in a lot of overworking and overgoing, that actually these are in some cases people that haven't develop that sense of identity of who I am, what do I want, what do I need, and really truly understanding that need. And yeah, Julianne's right. This kind of skips breakfast because it could be tied to how her family perceives meals. And from this perception, it can cause her anxiety and fatigue and figuring out what she wants, right? Trauma also affects kind of areas of the brain that make it really hard to stay in the moment, like I said before, right? And when we're thinking about food and food prep, it's very much around I have to be in the moment in order to do this. And being in that moment can kind of go back to that, what we were speaking about before, that trauma trigger. So that trauma trigger doesn't have to be just knowing the dates of bad things. That trauma trigger could also be thinking about what goes on within the day that could bring up these emotions where this client feels unsafe. So when we're starting to think about kind of this notion of working with the kind of traumatized people, I see it through this lens of kind of this discomfort of getting healthy, right? If you have experienced a lot of trauma and you've spent the majority of your life kind of in this trauma responsive state, in this dysregulated state, healing itself can become very uncomfortable. And our body will almost kind of push against it. So this notion of kind of healing and healing through food and healing through fitness, which I think are some of the best things that we can do for people who've experienced trauma, it is we if we think about it, is actually what we're training our clients to do is to work through the discomfort of being healthy, because it will be very uncomfortable. And the trauma response to discomfort is to disassociate, is to move away from it. So it can be quite difficult to then follow a healthy lifestyle or a food regime. And it can be a lot of back and forth, back and forth. And these can be the clients that you end up feeling very frustrated with, and it brings up a lot of your own emotions. So when we're working with clients like this, we're thinking about kind of no blame, no shame, kind of thinking about the language that we use and how we kind of create a safe psychological space so we can explore some of these things. We're thinking about kind of practice and not perfection. So we're not thinking about, okay, let's put in a sleep routine, and that sleep routine is going to be it needs to be exactly this. It might be thinking about things in relation to stages, or thinking about where you are on different days or different weeks. This kind of plan that I'm giving you, if you can do this, you'll be doing really well. If you have extra energy, this is what above and beyond would look like for this day. And that would be really cool. But there's no need to do that. If you feel like you can do it, do it. If you can't, let's stick to this. If you're having a really bad day and you're kind of feeling unsafe within yourself, this is your backup plan. This is the bare minimal that I need you to be doing in order to reach some of our goals. And understanding, yes, sports is about movement, but and we speak a lot about kind of moving through discomfort and moving through pain, and kind of moving through trauma and creating this resilience in our nervous system. The kind of the other end of that spectrum is being able to sit still and being able to do the stillness side of things, because the stillness is where a lot of the trauma can come up. And that's where I see a lot in this, in the kind of the overtraining aspect of things, and the not being able to be still to make food or to eat food. And I know we use this kind of this notion of resilience, but I also like to use the notion of grit, mainly because I was reading the book about grit recently and it stuck into my head. But this kind of, how do we keep working through this discomfort? How do we work with our clients and let them know that this might be uncomfortable for them? And actually, this type of discomfort is safe. It's something that they're choosing to do. So when we're thinking about the kind of sensitivities to food, or changing food habits, or their relationship with food, and the fact that being healthy might be something that's very new to them and that might make them feel very uncomfortable. How do we build their psychological resilience in this area? So Ian gave me 45 minutes. We're just kind of rounding that up now. So this is probably a pyramid that I will continue to work on for a very long time, and it might change from a pyramid to more of a kind of a cycle. But when I'm thinking about working with clients, I'm really thinking about, first of all, safety. How do I create an environment where they feel safe? Because that safety creates regulation. So always being able to kind of bring my best self to my clients so I'm regulated, so I can create this kind of psychological safety with them. Because the more that they feel safe with me, even just being in a session with me can help kind of create that regulation, and never underestimate how powerful that is. So first of all, I am from a trauma perspective, I am thinking about nervous system regulation. Then I am thinking about that kind of that mind gut kind of connection, and what does that mean on a psychological level, but also in the work that we do through nutrition. Then I start to think about the kind of the relationship with food, and what does the relationship for food feel, kind of what does that symbolize for my client, and what might be going on there. I started to develop kind of like worksheets and reflection sheets, so they start to kind of tune in not only to themselves and their bodies and how they're feeling, but what do they feel when they eat certain types of food? What does it feel like to sit down and eat a meal? And having that kind of food journal that's not just about what they're eating, but how they're eating and how they're feeling. And then actually with these clients, I'm working on nutrition all the way through, but it's almost, nutrition is like kind of my last thought process in a sense, because I need these other things to kind of be working and functioning in order to getting them out of this kind of this fight or flight or this disassociated matter, in order to kind of start that healing process and do that kind of top down stuff. So this is my kind of bottom up, top down that we would see in kind of normal therapeutic areas, which would be talk therapy and then somatic therapy, but using it through a more kind of nutrition focused sports nutrition lens. So with that being said, I'm going to stop because I think my time is up. And if you have any questions, and I can answer them now.
Thank you, Whitney. That was great. I'm always fascinated listening to you. So we've just got one question in the box at the moment. So everyone else, if you've got any questions for Whitney, please fire them into the chat box at the moment. We've got a Scott's question. Does the research or from your experience indicate any particular cohort based on cultural background or creed that are more prone to report trauma or less likely to report trauma?
For me, I do a lot of work in neurodivergence, and I think with my kind of neurodivergent clients, I tend to see more trauma. And that tends to be because for two reasons. Neurodivergent people tend to have a hypersensitivity when it comes to their nervous system. So that threshold of being kind of overwhelmed is lowered because they're already normally experiencing a lot of additional sensory processing. So then kind of to throw them over the top of that, um, it's like, for a neurotypical, you might be going from 20 to 100, whereas a neurodivergent, you might be going from 80 to 100. So it's a smaller kind of gap there for that overstimulation, that overwhelm. And also, neurodivergent worlds tend to not, neurodivergence tend to experience kind of more trauma because the world's not meant for them, like not meant for them, but not built for them in that sense. It's a very neurotypical world. So kind of going into the school environment, going into the work environment, there can be a lot of kind of opportunities for kind of the experience of trauma there. So that's a kind of a realm within itself, and that can get quite interesting. And there's a lot of research coming out there, especially in relation to like the overlap between PTSD and autism. So I see it a lot there.
Okay, more questions, folks. I've got one for you, Whitney, if you don't mind.
Yeah.
Can you go back to your pyramid that you created? So, a lot of us probably listening obviously work with nutrition, maybe in sports nutrition. The bottom layer that you've created, you gave a brilliant case study of Sally, and she is a kind of typical client that some of us will see from time to time, where, as you said earlier, you might give her some good suggestions, but things don't seem to stick too well. Um, so how do you access that base layer? How do you, when Sally has slowed down to eat her dinner in a mindful fashion and thoughts come up, how do you work on that safety so that she can calm the nervous system?
I think it's about kind of creating that safety kind of from the get-go. And what does it feel like to sit down? What does it feel like to be in tune with yourself? And I think it's a very slow process. And this is where it might be useful to have other people on the team, like a kind of trauma professional or psychologist, to work with what's coming up because this is the delicate thing, right? When someone stops, their trauma can come up. And when that trauma comes up, that's where they can be at risk of feeling very unsafe. So they might then uh, kind of disassociate from the work itself. So kind of drop you as a practitioner and kind of go off and find someone that is going to kind of collude with the way that they're working. It could bring up kind of feelings of wanting to harm or kind of for our work, kind of wanting to binge eat, wanting to kind of do things that kind of trigger that shame. So I think kind of especially when I'm working with adults, I'm thinking about a psychoeducation. I'm thinking about kind of working with them to think about these things. And the thing about trauma, and when we've experienced trauma, it can be very hard to think about that trauma. But we could think about it as in we become the kind of the thinking mind. So we might be able to think with her, well, what happened there? Kind of how did this happen? or we might be thinking on her behalf. So I might be thinking about how do I build that resilience to sitting down and sitting still. And that might be, could you sit still for 10 seconds one day and have a chocolate bar? Or what would it be to walk slowly when you're eating? And I know these things aren't ideal, but I would be thinking about that particular client and how could I build them up to the point where they could sit down and have a meal where it's not going to be a potential harm for them. And again, so I would think that almost through like the same way that I would think about like a strength and conditioning program, right? I know what the goals are, and I'm kind of working through this day we're going to do this many reps at this weight, and then next day we'll do this many reps at that weight, and be thinking about how do we kind of build up that nervous system resilience. And we might be thinking about, well, what are some of the things that make you feel safe, or what are some of the things that you like to do when you're eating, and start with that and start to just reduce it over time. Does that make sense?
So essentially baby steps and, often the model of a nutritionist who might only do a few sessions might not be enough.
Hmm.
And you might need to get into more of a longer coaching model with them.
I think developmental trauma can be quite difficult to work with because you can think about it in the sense of if a person was 2 when they've experienced their trauma, there will be a part of themselves that is kind of stuck in that 2-year-old. And you think about what is a 2-year-old's relationship with food, and how would a parent kind of parent that child to try new foods and eat kind of eat well and eat in a regime. It's almost like kind of thinking about, okay, you might not necessarily know when that trauma is, but you would kind of almost think about it, okay, well, what does it look like to work with a child and get them kind of regulated when they're eating and in a good eating regime? And I don't mean that in a patronizing way, but that's the thing with trauma, it can trap us in the past. And kind of when I do work with kind of in outside of nutrition, and we're thinking about kind of social services and NHS and mental health, we're thinking about how do we work with the adult while also working with the inner child and that kind of where that child is stuck. So food, for example, I'd be thinking about, well, where potentially could they be in that kind of developmental phase? Sally seems to be someone that needs that kind of, okay, we're going to sit down, we're going to eat food, and we're like, what, how would I parent her in that sense without being patronizing kind of thing?
The inner child work is really fascinating.
Hmm.
Um, Julianne has a question. Many individuals with eating disorders also have mental health disorders. So what procedures and methods would you recommend a nutritionist or dietitian to do to help those who are afflicted with both mental health disorders and eating disorders?
I think we have to be very careful because I think it comes down to very much a kind of a client to client uh case in the sense. Um, I think for me, I work very similar in nutrition as I do kind of in the outside world. And I think it's about kind of, does that nutritionist or dietitian have a clinical supervisor, have someone to talk through this case with when we're thinking about things like kind of mental health disorders, when we're thinking about things like eating disorders. I thankfully have a clinical supervisor that I've worked with through my kind of psychodynamic career, who just so happens to have a wife that went to CNM and is a trained nutritional therapist, so can understand how the worlds collide. So I have someone to talk to make things safe, because I do think it is a very kind of case by case scenario. And when we're thinking about trauma, we could be thinking about a range of different things, from control to kind of, you could go into psychoanalytical terms and start thinking about second skin and kind of those kind of theories, to kind of actually, this is about sensory processing, and this is someone with a heightened sensitivity, and there's a sensory process to it, or even self-soothing, and the fact that, Ritz crackers always taste the same, and there's a safety in that sameness, whereas blueberries will taste different with each one, and that difference can represent a lack of safety on an unconscious level, and sameness is safety. So we could see the kind of that beige eating or eating the same thing over and over again as a symbolic of safety. But I think these things always need to be a kind of case by case, and working with someone who is kind of clinically trained in kind of psychology, mental health, and that area, and working in a team to support that person.
Good answer. So that's another use of the word integrative is the integrative practices, and having a good network of practitioners around you, and also mentoring, so you're an experienced practitioner, but you still have a mentor that supports you that you can talk to, and that's kind of like an athlete working with a coach. It's such an important relationship. So thanks, Whitney. That was brilliant. And hopefully you've all really enjoyed that. Um, we'll be doing one webinar each month, and we've already got the next one up with Rachel Bartholomew. Um, why the quality of your food matters way more than you think as an athlete. So that one's on the 4th of June. So come and join us for that one as well. So thanks, everyone, and see you next time.